It's a Northwest lifestyle weekend on Como News. Now it's time for IRG's Health Talk, tackling health issues that slow you down on and off the field.
Dr. Andrews, thanks for joining us today.
Keep these kids on the playing field and out of the operating room.
Jamie, welcome to you and your wife, Karen, and the Moyer Foundation.
Thanks for having me on today, Shannon.
Get the full story on causes, treatments, and more from the region's leading healthcare experts.
Dr. Gayeth, what are some common hand injuries?
The most common hand and wrist injuries I see in golfers.
Dr. Kotze, let's talk about the elbow.
Children usually get an elbow fracture.
Dr. Barrett, how long does a typical knee replacement last?
We expect 15 years.
IRG's Health Talk is brought to you by Integrated Rehabilitation Group with 34 physical and hand therapy clinics throughout the Pacific Northwest.
What are these Olympic gymnasts going through right now?
They are going through a lot of tough workouts. This is it.
Here are your hosts, Tom Hudler and Shannon O'Kelly, physical therapist and president of Integrated Rehabilitation Group.
Well, welcome back, and thanks once again for being with us. Guest number one today, Krystal Richardson, a doctor in naturopathic medicine. We're going to find out more about what that is, but I think it's something, Shannon, if I'm not mistaken, seems to be becoming more and more popular these days.
I think so too, Tom. I mean, particularly in the Puget Sound, we tend to have an environment that's conducive to kind of a holistic approach, team approach, interdisciplinary approach, and naturopathic physicians are part of that team.
All right, let's hear from Dr. Krystal Richardson from Naturopathic Medicine and Shannon O'Kelly.
Dr. Richardson, welcome. How are you?
I'm doing well.
I'm glad you're here. I want to talk about the difference between naturopathic medicine and general medicine and really emphasize the training and your interest in becoming a naturopathic physician and mostly as a primary care role in that naturopathic field. So tell us about medicine.
Yeah. A lot of people don't realize that naturopathic doctors can be primary care doctors in the state of Washington. And that really is how I function. I am a primary care doctor, which means I see all ages from newborns. I saw 4-day-old yesterday on up. And I take insurance. And so patients have the option to see me for their primary care. And that really doesn't look that much different than a conventional doctor. I do the same history taking. I do the same physical exam, comprehensive exam. I do the same steps to get a diagnosis, lab work, imaging, referring out if I need to, put together a treatment plan for patients. The differences really lie in the amount of time that patients get to spend with me. That's a really big one. Patients get to spend an hour with me for their first office call and half an hour for their return office call and 45 minutes for their physical exams or their physical checkups and their annual exams. So patients really get to create a relationship with me, and I get to see them and learn about them and learn about their lives and their history. And that maybe is one of the biggest differences in naturopathic medicine versus conventional medicine, and a difference for me in seeing patients and what I do.
You know, I have to agree. As a therapist, what I've always enjoyed and really what my interest is physical therapists get an opportunity to really get to know their patients because we see them 2 or 3 times a week for an hour. So building that relationship, and sometimes from a therapy standpoint, it's more that relationship that matters than maybe the technique that we're using. Tell us about your training. I think our listeners, it's important. What I'm seeing personally is after doing this for 30 years, there seems to be more and more acceptance and more of a holistic approach to healthcare. And I think that's where naturopathic physicians really fit in.
There is. And my training is very similar to a conventional doctor's training. It's a 4-year medical program. I spend the first 2 years going through the basic sciences and that whole side of things, anatomy, physiology, pathology, and the second 2 years in still some classes, but also then in clinical rotation. The difference really is in the addition of all the alternative side of things and the addition of the nutrition and lifestyle and that side of things and that counseling that I can do with my patients. I was actually just looking up some numbers the other day because I was interested, and there was a study done in the Washington Post, I think it was in 2014, about how conventional doctors, only about a quarter of them report being able to adequately educate their patients on diet and lifestyle changes. And the top 3 leading causes of death in the U.S. right now are heart disease, cancer, and medical error. And so heart disease largely prevented by diet and lifestyle changes. A third of the cancers are preventable by diet and lifestyle changes. So it really, really is important to focus on preventative medicine and focus on those foundations of health. And that's probably where my education differs the most, is that there is a large emphasis on nutrition and diet and lifestyle and making sure that the foundations of health are on board for my patients. Interesting.
So what would be the difference for our listeners, again, just education-wise, naturopathic approach or homeopathy?
They're actually very different things. Naturopathic medicine is very similar to conventional medicine in that we can do all of those things, diagnose, treat, all of those things. But homeopathic medicine is an entire different philosophy that some naturopathic doctors use. It's not something that I particularly use in my treatment plans.
So we were talking about the difference between naturopathic approach or a homeopathic approach, and you described that and explained it. So as a naturopathic physician, you're going to do the workup and all the history and physical as you described it. But the difference is you're going to prescribe natural remedies versus man-made pharmaceutical remedies, maybe. Is that kind of...
Not always. Really, my education allows me to prescribe and to recommend anything on that spectrum. So one of the principles of naturopathic medicine is first do no harm, and another is treat the cause. So I'm going to lay out the options for patients, both in the alternative side, botanical medicine, nutrition counseling, those sorts of things, and the conventional side. And I'm going to help them pick something that works for them. It's really important that what they decide to do fits in their life, both financially, economically, time. They need to be able to have the time to do what's going to treat their illness. And so I can choose from all ends of the spectrum, pharmaceutical medications, botanical medicine, all of it is in my grab bag.
Where are the roots of naturopathic medicine? I mean, how long has it been around?
Oh, goodness. It has a very, very vast history. It has been around for many, many, many years. Some would say that it was maybe one of the first types of medicine, really getting back to nature and letting nature heal you and treat you and getting back to the foundations of health, diet, exercise, stress relief, all of those things. And then it made a resurgence in the past few years, coming back and people really realizing that there's a need in conventional medicine and in today's world that really focuses on getting out in nature and eating healthfully and doing all of those things. And naturopathic medicine fills that need. And so it's made a big comeback, but it has been around for many, many, many years.
And as a family practice emphasis in naturopathic medicine, I mean, do you use a different approach, obviously, for pediatric patients versus geriatric patients, different remedies?
Oh, yeah. There's, just like in conventional medicine, there are herbs that we want to use in kids and there are herbs that we don't want to use in kids. And so, it all comes down to safety and what's indicated and what's necessary. We always are going to try to use the gentlest and the least invasive treatment protocols that we can to get a patient back to health. And so it's all very individualized and personalized.
Got it. What would you say, in your experience, is the number one thing that patients seek you out for?
Really the education piece. They really want to know what's happening in their body, and they want to take the time to be able to talk about it and to understand it. And having that time with me is really, really important. And that's probably what most people seek me out for.
Thank you very much for the information and your time. Again, I just want to mention and how important it is that there's a team approach in medicine, and people are much more accepting of that today. So working collaboratively with naturopathic physicians, conventional medicine, physical therapists, the whole healthcare team is so important.
We are all on the same team, and we're just another option for patients. But our main goal is to get patients healthy. That's all that we all want.
Absolutely. Good stuff. Thank you.
Naturopathic medicine. That's our guest, Dr. Krystal Richardson. And boy, that's some interesting stuff, Shannon. I don't know if it's something you've paid much attention to before. You hear about it. You don't really, at least in my case, pay much attention to it or really delve very far into it. But that's something that, is something you might want to consider in certain cases.
Well, it's an option.
Yeah.
And more of my patients that I talk to are maybe seeking out naturopathic physicians. The reality is, I watched this program the other night on deforestation of the rainforest in the Amazon, and there's a lot of medicinal plants and, a lot of the tribal people in those areas, indigenous, that's what they've used all their lives in history, right?
It worked for them. If you'd like more information on this topic, as well as how to contact Dr. Krystal Richardson, go to nfmseattle.com or go to irgpt.com and click on the Health Experts tab.